How does rheumatoid arthritis cause uveitis? Rheumatoid arthritis, often known as RA, is primarily an autoimmune condition affecting the joints. However, it can also lead to complications, including uveitis. Uveitis is inflammation of the uveal tract, which includes the iris, ciliary body, and choroid. While RA is not commonly linked to isolated uveitis, it can cause scleritis, an inflammation of the sclera, the white part of the eye. This scleritis can then lead to uveitis as a secondary complication. The connection between RA and uveitis involves immune system dysregulation. In RA, the immune system mistakenly attacks the body's own tissues, including parts of the eye. This process is driven by immune cells such as T helper cells and natural killer T cells, along with pro-inflammatory substances known as cytokines. These immune mediators create an environment that can damage ocular tissues, leading to inflammation. Interestingly, uveitis is more frequently associated with other rheumatic diseases, particularly seronegative spondyloarthropathies like ankylosing spondylitis and psoriatic arthritis. These conditions often share a genetic marker called HLA-B27, which increases the risk of developing uveitis. In contrast, patients with RA typically do not have this association, making isolated uveitis quite rare in this group. In children with juvenile idiopathic arthritis, which is related to RA, chronic anterior uveitis is more common. This type of uveitis can cause serious complications if not detected early. The exact cause of uveitis in these cases is not fully understood, but it is believed to be immune-mediated, similar to other autoimmune processes. Therefore, screening for uveitis in children with juvenile idiopathic arthritis is crucial, as the inflammation can be asymptomatic at first but may lead to vision loss if left untreated. When managing uveitis in patients with RA or related conditions, controlling inflammation is key. Treatment often involves using topical corticosteroids and cycloplegic agents to prevent complications like synecdoche, which are adhesions in the eye. In more severe or chronic cases, systemic medications such as methotrexate or tumor necrosis factor inhibitors may be necessary to manage the inflammation effectively. In summary, while rheumatoid arthritis can lead to uveitis, it does so indirectly through scleritis and immune system dysregulation. Isolated uveitis is uncommon in RA, but the underlying mechanisms involve autoimmune inflammation that can damage tissues. Regular monitoring and appropriate treatment are essential to prevent serious complications in patients with RA who experience inflammation. Always consult a healthcare professional for personalized medical advice and management options.